Time is running out for a big batch of AstraZeneca vaccines in Ontario. 45,000 doses expire on Monday. They're supposed to be given to people in Ontario who got a first shot of AstraZeneca, now want a second dose, but many pharmacies are still waiting to receive them.
The runway is short now with 4 days left, and there are over 99 pharmacies in Toronto still waiting for vaccines that were promised over the last couple of days. So this is a precarious position to be in, and certainly the frontline pharmacists are feeling it.
One family physician says she had more than 200 of the expiring AstraZeneca doses in her clinic ready to give out, but public health came and took them today. That doctor is Michelle Cohen, and she's in Brighton, Ontario. Dr. Cohen, thanks very much for joining us. Just walk me through this process. You had these doses in the fridge, but unable to give them to people and not clear what to do with them. Is that the understanding?
Exactly. So we got AstraZeneca in April, and so we had run multiple successful vaccine clinics for the local community. And then on May 11th, we were told to pause our clinic, so we had to cancel a number of them. And then we had vaccines sitting in our fridge, about 230 doses sitting in our fridge for the rest of May. And we asked repeatedly for some guidance on what to do. I had hoped that perhaps we could offer a second dose clinic to the folks that we had given first doses to on a shortened interval, like a 4-week interval. And instead, we were given no guidance. So in frustration yesterday, I tweeted pretty angrily about the situation of this expiring vaccine. And this morning, public health came and claimed it. And so I'm hoping that they will redistribute it, but I honestly have no idea what's going to happen next week.
Yeah, and we just heard from the head of the Ontario Pharmacists Association saying that, acknowledging the runway is very short. You've got sort of 3 days to get thousands of doses, and it's only for specific groups of people. It's not like anybody can get this. It's only for people who got that first dose relatively early on in mid-March. Do you worry that AstraZeneca doses, these things that, any dose was so valuable a couple of months ago, and now there's the potential we'll be tossing it?
Absolutely. I think it's unconscionable that we would be sitting on vaccine, sitting in our fridges knowing that it's going to expire and only allowing a very narrow group to receive their second doses. And this is after quite a lot of time wasted sort of dithering back and forth about what to do about it, knowing that there was this deadline coming up and seeing parts of the world that are really on fire with COVID, and having vaccines sitting around in our fridge just to waste some of it ultimately, or hopefully not all of it, but some of it likely will go to waste. And I think it's just shameful.
Practically speaking, you were calling for, you wanted to see something happen sooner than this. What would you like to have changed?
Well, I think if we could have given the vaccine, if we were deciding that we weren't going to use it in Canada, I think we should have sent it abroad. I think India would have been an excellent place to send it, for example. But if we were deciding that wasn't possible, then I think we should have tried to use up the vaccine that we had. So the second doses, the risk is much lower with second doses for patients who have an opportunity to be informed and make a decision about whether or not they want to get AstraZeneca, a second dose, or whether or not they want to get it on a shortened interval. I think they should have been given that opportunity rather than have vaccine just sit around until it expires.
I should ask, why could you not just give them to people that you gave the first dose to?
Well, I was waiting for public health guidance, so I'm not going to just go rogue on my own, even though I'm getting encouragement to do that on Twitter. I'm not going to go rogue and just start giving vaccine without any sort of guidance. So I was hoping that I could have a conversation with public health, or I was hoping that the ministry could give us some guidance on it. Ultimately, the public health is being guided by the ministry anyway, so I don't want to put too much blame on them specifically. Mm-hmm. They're dealing with some very poor communication coming down from the ministry, and they're restricted by the decisions that the ministry is making as well, equally as I'm restricted by the decisions that public health directs me to make.
Yeah, just so we're abundantly clear to people watching this, that the doses that are set to expire have essentially now been allocated to the people who got vaccines in mid-March. And those people, because of the way the distribution worked back in mid-March, are primarily in Windsor, the Toronto area, and Kingston. You're not in one of those locations, which is why they came, picked them up and redistributed them, and now they have to basically go through quality assurance and make sure that they are still good after having gone out to places and put into fridges. What do you think ought to happen now with AstraZeneca, not just these doses that are set to expire, but there are tens of thousands more that we're expecting as early as next week.
I honestly don't know. I think if we're not going to use them, then we shouldn't be accepting them. Ultimately, I think it's really unfair to be a wealthy country, to be receiving vaccine that we're not even sure what we're going to do with, and then have it sitting around while our politicians try to make a decision. So if we're not going to accept it, I think we need to send it somewhere else. Or otherwise, we need a concrete plan for how we're going to use it, and not change our decision, partway through, and start coming up with other policies and other rules, and kind of just leaving these situations where I don't know how many small towns have 200 or whatever vaccines sitting in their fridge that perhaps is not going to be claimed because they didn't make enough of a stink about it. So these decisions can't be made on a Friday, before the vaccine expires on a Monday.
Dr. Cohen, thank you very much.
Thanks very much for having me.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.